Hi William, thank you for agreeing to my interview. Before we start, would you be able to briefly introduce yourself?
Hi, William is my name. I'm one of the interns at a hospital.
Okay, my first question is, what are some of the effective communication skills that you often use with your patients?
So, in every consultation, I try to establish rapport with my patients. So, this includes building trust and make sure the patient feels comfortable. What I usually do is start with a warm greeting and try to maintain a good eye contact throughout the consultation. I also like to avoid using any medical terms. This lowers the patient's understanding of what I'm saying and also really distracts patients within the interview.
Yeah, I often had like a couple of experiences where doctors will ask me how I'm going or what I'm doing at uni, and just from that, I just feel really relaxed and really comfortable speaking to a doctor.
Oh, that's good. That's reassuring that it's working. So within the consultation itself, I usually start with a very open question. So what brought you into the hospital or something like, can you tell me from the very start what's happened?
Mm-hmm.
And they usually give me a story of what has happened throughout the day. And from then on, I go on to ask them more closed questions such as what symptoms do you have, what are the concerning things that you'd like to talk about today, and the list goes on from there. And I also, again, I'd like to emphasize using non-medical terms for the said reasons.
Okay. Would there be any other communication skills that you use according to different circumstances or situations?
Yeah, so this sort of consultation style is when I'm seeing a patient in like our patient clinic where I have a lot of time to go into very detail of patient's history. Mm-hmm. But when I'm down in ED where time is very short and giving quick treatments is important, I ask very narrow questions. So this includes what symptoms do you have? Do you have this symptom, mm-hmm. or do you not have this symptom? Have you been immunized for this condition, or do you have this medical condition? Questions that are ending with yes or no question type are usually the things that I ask down at emergency department.
Would there be any situation in emergency where you have used communication skills that was much more effective compared to clinical type of communication skills?
A good example, I guess, for that would be when I'm having chat with patients who have like a peanut allergy, mm-hmm. which requires rapid treatment and early diagnosis to improve their outcome. So in those situations, I ask, do you have any allergies do you know of? Do you have any medical conditions do you know of? Do you have this type of allergy? Do you have that type of allergy? What was the trigger? Do you remember? Do you have shortness of breath, which is a very common symptom for allergies? So those things really narrow down my differential diagnosis list early, so I know what treatment to give on the right time.
Okay, so in an emergency setting, you usually just give direct and straightforward kind of questions for like a quick answer for an emergency patient.
Yeah, so more direct instructions and questions.
Okay. Do you often feel anxious or nervous in emergency situations, or do you?
Yeah,
okay.
So emergency departments patients who require rapid treatments, so that makes me feel quite anxious, and also at times I have sweaty palm because I need to do things very quickly. So in those situations, yeah, I do feel nervous, and if so, then I usually seek advice from more senior doctors to make sure that I'm not missing anything and asking the right questions from our patients.
Okay, so when you are usually nervous in emergency situations, you look up to superior doctors just for their advice and make sure you're on the right track just to avoid mistakes.
Yeah, that's right.
Okay, is there any other communication skills that you used with your colleagues or with your supervisors?
Yeah, so with my supervisors or colleagues, I use more medical terms to get their understanding quicker. Mm-hmm. So I go by the structure of ISOBAR. Mm-hmm. So ISOBAR. I being introduction, so I say what my name is, which ward I'm from. As for situations, so what the patient has complained about and what their situation is at the moment. O for objective measures such as their vitals, what investigations they've had done. B for their backgrounds and what medical history, what surgeries they've had in the past. A4 assessment, so what I found in my physical examination, and offer recommendations. So I usually ask, what treatment do you advise for this patient? What should my management be from now onwards?
Okay, so you really just start from the basic, from introduction to going into more deeply about knowing what has happened, from situations going into what the problem is with the patient, and if they have any history of like illnesses, and then you recommend to a patient what